Okay, so Medicare, what is Medicare? Well, Medicare is our national federal health program, primarily for people 65 and older, but people under 65 can also qualify for Medicare if they have certain disabilities like end-stage renal disease, Lou Gehrig's disease, Parkinson's, things that qualify them for Social Security disability, then also would qualify them for Medicare. So you'll hear the term a couple times throughout the presentation, original Medicare, Parts A and B. That's what was passed into law 58 years ago, this past July 30th, 1965. So this is kind of a fun slide to put in perspective what's going on today. We all know we're part of this massive bubble of people called the baby boomers. So a few years ago, they tracked down this lady, Kathleen Kirchling, and determined she was the first baby born a second after midnight, 1946 after World War II, kicking off a 20-year span in America where 80 million babies were born. Thus the baby boomers. So right now, we're going through kind of the bubble within the bubble. So a very high percentage, about just shy of half of all those babies were born from like 1956 to 1962. So we've got this massive bubble kind of going through the system. Today people go, well, where'd all the workers go after COVID? Well, they're all retiring. That's where they all went. So on any given day, as many as 14,000 people a day are turning 65 in America. So we've got about somewhere around 60, pushing 69 million people in Medicare. And if things continue till 2030, which is the end of the baby boomer run, we could have as many as 80 million in the Medicare system, which statistically might represent somewhere around 23% of our total population in America will be on Medicare. So some pretty big wow factors going on today in America. So who runs Medicare? You'll hear us refer to it as Medicare, the government. Technically, it's CMS, Centers for Medicare and Medicaid Services. They run Medicare. They coordinate with all the various states on the Medicaid programs, and they also are responsible for oversight and rule of the ACA, Affordable Care Act, otherwise known as Obamacare. So the four parts of Medicare, I'm going to talk a little bit about A and B. I'll turn it over to Grant for C and D, and then the rest of the presentation. So original Medicare A is the hospitalization benefits of Medicare. Very comprehensive benefits for being in the hospital. You've been in the hospital, now you need rehabilitative care, skilled nursing care. You're now at home, you need home health care professionals to come to your home. You've been diagnosed as being terminally ill, hospice care. So very comprehensive benefits for those. Go to any hospital in America that you want to go to, they'll accept original Medicare Part A. You want to go to Mayo's Clinic. You want to go to MD Anderson. They'll welcome you with open arms with Medicare Part A. Part B of Medicare, that's all of your care outside of the hospital. So that's your doctors and specialists and outpatient procedures, surgeries and exams and lab work and tests and MRIs, CAT scans, x-rays, medical equipment, wheelchairs, walkers, beds, even CPAP machines for sleep apnea. It's all your expensive medications like treatments for cancer, chemotherapy, radiation, or infusions that you get at a hospital, doctor's office, clinic. All your annual wellness screenings and exams, so things that, are covered under your plan here at work as well, so getting your annual wellness exam, flu shots, pneumonia shots, vaccinations, women's well checks, colonoscopies, cancer screenings. There's 24 of them today that are covered one time a year at 100%. So that forms what is known as original Medicare A and B. So I'm going to turn it over to Grant here, and then he's going to take you through C and D, and then we'll kind of talk a little bit more in depth about how you access it, et cetera.
Just talking to this there. I'll talk into this. So, yeah, for about 30 years, that was really the only option people had. Then in 1997, this concept, early 80s, mid 80s, this concept of a HMO network out in California was coming to be by a company called Kaiser Permanente. And they said, hey, we're going to build an HMO network where we're going to go work with hospitals and doctors, and we're going to get contracted pricing, get really good pricing with them. And Medicare said, we've only got one option for everybody on Medicare, A and B, and you can go get what's called a Medicare supplement. Well, we really like this concept, and we want the private insurance companies to enter the market and offer a secondary or an alternative option, and that's exactly what Part C is. So Part C is the alternative to having A and B in a supplement. It's your private insurance option. So these plans, I like to say, they look, they feel, they operate a lot like the insurance you have here at work. So they're network-based. They're through the private insurance companies, so United Healthcare, Humana, Aetna, Cigna, Blue Cross, they all offer Part C Medicare Advantage plans. So why are these plans called the Advantage plans? Well, you're probably seeing all the advertisements on television. We call them the quarterback commercials, Joe Namath, J.J. Walker, the football players of the world, right? They're all advertising these Part C plans, and they're called the Advantage plan because there's zero monthly premium. And on top of the zero premium, you get all these added benefits, dental and vision and hearing. They'll take you to and from the doctor's office. They'll deliver meals to your door after an inpatient hospital stay, maybe a skilled nursing visit. There's a gym membership. They'll let you get a MasterCard in the mail, and you can take that over to a CVS, Walgreens, Hy-Vee, and it's got $100 on it every 3 months to go get over-the-counter items. So Band-Aids, vitamins, aspirins, supplements. So there's all these added benefits, all for zero premium. So you say, well, why would I turn that down? Why would I turn that down? It might be too good to be true, but zero. I don't pay for anything. Well, no, that's not quite the case. So you pay zero premium, but with these plans, you have a max out-of-pocket limit that you will pay towards. These plans, while you're hitting that max out-of-pocket, consisting of copays and coinsurance, when you use the plan, it's managed health care. Quite literally the opposite of A and B. A and B is not managed health care. So the insurance company you have is going to tell you where to go. Okay, so there's an HMO or PPO networks where there are no networks with A and B. This plan and the insurance company might tell you, hey, we understand that you and the doctor want to replace that knee, but we want the doctor to do this, this, and that first, and then we'll give it some consideration. So that's the major difference between A and B and then a Part C plan, which is the alternative option, is that it's managed care. And we'll talk a little bit more about that.
So your original Medicare A and B, your universe of healthcare providers is everybody. No restrictions, go anywhere you want. Your universe of providers with an Advantage plan is still very good, but it's going to be more narrow. I like to talk with my hands. So that's really the big distinctive difference is you have total control of your health care with A and B. Under C, still not different than what you've been used to, but you're in a network environment. You have to get things pre-approved, pre-authorized. You want to make sure you stay in network because if you go out of network, you're going to have a much more significant cost outlay or possibly not even having your care covered. So there are distinctive differences between the two.
You can hold on. I'll try and talk through this. So the last part and the final part is Part D. It's strictly just pharmacy coverage at the pharmacy counter. So that's what Part D is. And we'll talk more about that on this slide right here. So this slide right here is what we like to call the blueprint or kind of the roadmap to Medicare. So when you're getting ready to...
And by the way, guys, sorry, we should have told you this. In your kits, when you open them up on the right side, the main key slides, this one, there's a bullet point page with the 4 parts and the bullets under each is what they cover. And then there's a couple more that we'll talk about here in a minute. So sorry we didn't mention that to begin with.
All right, so when you're getting ready to join what we like to call your Medicare journey, you're right at the top of that chart there. And then you come to the crossroads, and you've got to make a decision. Am I going to go left, or am I going to go right when I want to start Medicare? You've got 2 options. If you decide to go down the left side of that chart, you're opting in to have original Medicare A and B as your primary or foundation of insurance. Part A, again, is very comprehensive coverage in the hospital. And Part B is very comprehensive coverage outside of the hospital, really at the doctor's office. Between the 2 parts, very comprehensive coverage, but it only covers 80% of the bill. And you're left with 20% coinsurance. And that 20% coinsurance has absolutely no limit. So sky's the limit. So 58 years ago when Medicare was signed into law. That wasn't great, but it wasn't terrible, all things relative. Fast forward to today in 2023, if all you had was A and B, a hospital visit, quite honestly, could maybe take your life savings away if all you had is 20%. So when you go down the left side of the chart, what you would look at adding is an additional piece of insurance called a Medicare supplement or Medigap. Interchangeable terms there. You can call it either one. What that Medicare supplement does is you pay a monthly premium to that supplement, and it will follow you to the hospital under Part A and to the doctor's office under Part B, and it will pick up that 20% coinsurance that Medicare does not pay. The only thing it's going to leave you with is a one-time annual deductible of $240. Once you satisfy that $240, you are at 100% the rest of the year for any other medical expenses at the hospital or doctor. 100% of all hospitals in America take Part A. 98% of all doctors in America take Part B. So it's quite literally universal coverage, all right? So you can go wherever you want to go to the hospital and see just about any doctor in the country. There is no insurance company involved, so there are no prior authorizations. There are no pre-approvals. If you need to get something done and the doctor sees it medically necessary, it'll get done. So that's the beauty of having A and B. Now, Medicare A and B will cover very expensive medications like chemotherapy or radiation treatment. It will not cover you at the pharmacy counter. So the final piece is to get what's called a Part D prescription drug coverage. That is an additional piece of insurance that you will pay a monthly premium for, and it will cover your medications at the pharmacy counter. There's about 26 different drug plans. It's not one drug plan fits all. The best drug plan for you, we can really drill down on that. It's based on your specific medications. So that's the left side of the chart, A and B, a supplement, and a drug plan. The alternative option would be to go to the right side of the chart. Now, you still need Part A and Part B before you can get to the right side. But when you go with the right side, that's the alternative option, the Part C Medicare Advantage plans. By law, these plans cover everything at the hospital under Part A and at the doctor's office under Part B, and they have prescription drug coverage built right in. One plan does it all, very similar to what you got here at work. Now, these are the Advantage plans because they are zero monthly premium, so you don't have to pay anything up front to have the plan. How it works is when you go use the plan at the hospital, the doctor, the urgent care, the emergency room, you pay copays or sometimes coinsurance until you hit the plan's max out-of-pocket limit. If you reach that max out-of-pocket limit, the insurance company says, okay, you've done what we've asked. We will pay your claims the rest of the year, so you don't have to worry anymore. All right? Now, the major difference with the Advantage plans is that as you are going to the hospital or doctor or trying to receive care, the insurance company has a say or an opinion in your health care experience. That is the managed care model or aspect on the right side of the chart. Furthermore, they have an HMO or PPO network, very similar to what you would have here at work. So on the left side of the chart, there are no networks, no prior authorizations, no pre-approvals. On the right side of the chart, you're working directly with an insurance company. There are networks, there are prior authorizations, and there are pre-approvals. Now, these Advantage plans take it one step further because they build in, on top of a zero premium, dental, vision, and hearing. Get your teeth cleaned twice a year, and most of the plans today will give you about $2,000 of dental benefits for anything above and beyond a cleaning. Get your eyes examined at no cost, and most plans will give you about $200 to go get yourself a new pair of glasses or contacts. And then hearing coverage is built in, and they'll give you an allowance towards hearing aids. So that's a really, really big benefit for a lot of people. Above and beyond that, they will add a gym membership. They'll give you an over-the-counter allowance to go get healthy items or supplements or vitamins, things like that, so over-the-counter items. And then, they'll even deliver meals to your door. So all of that sounds really, really good from 10,000 feet above for zero premium. The thing to understand about the Advantage plans, there's a couple pieces to it, but it's that it's managed health care. So you've got to be willing to deal with the insurance company that you choose. The other piece of that is that when you decide to go down the right side of the chart, we get asked this all the time. Well, Grant, I just turned 65. I can't remember the last time I met a deductible under my employer plan. So why wouldn't I go down the right side of the chart, pay nothing, go get a routine physical, that's likely what's going to happen, and then if my health does decline 5, 10 years down the road, I'll just switch back over to original Medicare and go get that supplement when I don't have to deal with the insurance companies anymore. Well, that's not really how it works. The supplement has protected itself from that. So if you go down the right side of the chart to begin your Medicare journey, it can be very difficult to get back to the left side. They'll let you come back and get A and B and have 80% coverage, but that Medicare supplement is going to underwrite you, otherwise known as ask you health questions and see how healthy you are, and if you're not healthy, they will just decline you the coverage. And then you're really stuck on the right side of the chart with the Advantage plan. That is one of the biggest myths of Medicare, is that, well, I thought I could go down the right side of the chart and then go left when I needed to. It's also one of the largest complaints Medicare gets every year, is that I was never told that I couldn't change my plan back to original Medicare. Well, the statement of, I went with original Medicare and you can always go back, or I went with an Advantage plan, you can always go back to original Medicare. That's not a false statement. The rest of the story is that you have to answer health questions to get the key piece of that puzzle there in that supplement. Now,
So when you enroll in Medicare Part B, you trigger a 1 and only 1 in your Medicare lifetime window to get that supplement on the lower left, guaranteed, no questions asked, have to take you, no pre-existing. It's called your open enrollment window, and it lasts 6 months. Once that window closes, it doesn't open again. So that's one of the things that people misunderstand. There's a lot of people out there that want to sell Advantage plans. It's unfortunately kind of a biased model that we've got, because that's why you get a lot of the phone calls and the commercials. They're trying to talk to you about Advantage plans. We actually, between you and me and the fence post, we can make more money on Advantage plans, so the model's a little biased. So, but as Grant said, it is one of the biggest complaints Medicare gets is, well, I didn't know that. And then down the road, of course, when do you think somebody wants to leave an Advantage plan on the right side? It's when their health isn't good. Maybe they're hitting their now $4,000 or $5,000 max out of pocket every year. Maybe they can't go to the doctor or specialist they want to go to. So I want to disenroll from that. And yes, you can disenroll. Right now is the period of time, the annual enrollment period, October 15th to December 7th, and go to get original Medicare. Basically, you pull original Medicare back to the forefront because it's quietly in the background, but now you got to answer health questions to get the supplement, and it doesn't take a whole lot to be declined for a supplement. So our whole goal whenever we talk about this is to make sure you understand the left side, the right side. They're both great options. It's like an apple and an orange. You know, they're both great pieces of fruit. They taste great. They're good for you, but they are distinctly different. So as long as you understand the short and the long-term consequences potentially of your decisions is really the goal. So with that.
Last thing I'll talk about on this slide is just we've mentioned the right side of the chart, zero premium, zero premium, zero premium. So what does the left side of the chart cost? Well, Part A, if you've worked 10 years or 40 quarters, you're going to get Part A for no cost. Part B is based on income. And so what Medicare does is they're going to look 2 years back, and whether you're filing individually or jointly, they're going to put you in an income category, and that's what they're going to base Part B on. Minimally, Part B is going to cost $174.40 a month for Part B, and then there's about 6 other income categories above that, all the way up to, as much as $700 a month. The Medicare supplement, based on your age and your geographic location, that Medicare supplement's going to have a premium on top of Part B. And then the drug plan. That does have a premium for the drug plan. There's about 26, 27 drug plans ranging from 50 cents a month up to $115 a month. That's just the premium to be enrolled, and then you have co-pays due at the pharmacy counter. So you have 3 pieces of insurance on the left side, all which have 3 separate premiums to pay. And that's something we can drill down on with you to show you the exact cost. Okay, so Part B, this just shows you, and this is in your chart there. This actually was just updated, so I think you guys might still have this year's, but this is for next year. If you file your taxes individually, you're on the left side. If you file jointly, you're in the middle. You can see that filing individually, if you make $103,000 or less, you're in the base income, or filing jointly, double that, $206,000, and you're in the $174.40 a month category on the far right over there. Then you can see there's 5 other categories from there, all the way up to $750,000 and above, right? So if you make more money, they charge you more.
When you enroll in Medicare, Medicare has a good relationship with the IRS, so they basically flip a switch and look at your 2 years back tax return. So if you file in 2024, they're going to look at your 2022 tax return, and they're going to look at the bottom line, your adjusted gross income, not your gross, but adjusted gross, and determine your amount. Now, people go, well, 2 years ago, I was working, my spouse and I were working, and now we're going to retire and go on to more of a fixed income. Well, you can appeal your determination. They give you a first out of the chute appeal, and you just simply explain, hey, I was making that income 2 years ago, but future forward, we're going to be making this. You submit your appeal to your closest Social Security office, and within a couple of weeks, they get back to you. And most always, you'll win your appeal, because every year they're going to look at your 2 years back tax return and determine your next forward amount. So for some people, it might be a little bit of a roller coaster. You've got varying income, in rental property, or you inherit some money or things like that. So it could fluctuate a little bit from year to year, but that's how it's going to work from here on out.
All right, so we know we've got 2 options when we join our Medicare journey. Now, how do we start, and when do we start? The first thing you have to do before you can go left or right down that path is you have to go enroll for Original Medicare, A and B. So when can we do that? Right when you're coming up on your 65th birthday, you're going to be in your initial enrollment window, your IEP. So it's a 7-month window that revolves around your 65th birthday. It starts 3 months before. It's the month of your birthday, and then it gives you a little 3-month parachute. If you enroll in the 3 months before your 65th birthday, it will start on the first day of the month you turn 65. So even if you're born on the 28th of the month, you still get it to start on the first day. And then they give you a little parachute just depending on your situation to enroll. Now, one question we get a lot is, Grant, I'm coming up on 65. I've been talking to my neighbors and been talking to people at work that are already 65, and they all told me that I've got to do something when I'm turning 65. But I want to continue to work, and I've got really great coverage here. So do I have to go sign up for Medicare? And the answer is maybe. There's a few things that play into that. So if you work for an employer that has less than 20 employees, the answer is yes, you have to. Now, you work for an employer that has many more than 20 employees. So the answer is actually no. When you're turning 65, you do not actually have to go sign up for Medicare if you wanted to stay under the group employee benefits here. The next step on that is, okay, you work for a large employer, quote unquote, which is more than 20 employees. Do you contribute to an HSA with a high deductible health plan? If the answer is no, I do not, then what I tell you is, yeah, it can't hurt to go get Part A. It's premium free. It'll sit in the background behind your employer plan. It'll pay if you ever go into the hospital. It's got to be a pretty catastrophic hospital stay, but it could pay. If the answer is, yes, I do contribute to an HSA, and I want to continue to be under the plan and continue to fund that HSA, then my answer to you is no, you do not want to sign up for Part A, because as soon as you do, you can no longer fund that HSA. So if you have any part of Medicare, you cannot fund an HSA any further. Now, you can use the monies out of that HSA, but you cannot put any more into it. So that's something very important. If you are contributing to an HSA under a high deductible health plan, you actually don't want to do anything at 65.
So that's one of the other big myths of Medicare is I have to do something at 65. You have what is called credible health coverage, and basically the only kind of credible health coverage you can have is coverage under an employer plan. So going on to Medicare anytime after 65, any month of the year is always a qualifying event to go on to Medicare. But there is no requirement. quite frankly, Medicare and the federal government would like you to stay off of Medicare as long as possible, so they like people that continue to work and stay under their employer plans. So, but there is not, oh, if I don't do it, now I'm a late entrant, I'm going to pay a penalty the rest of my life. The only point that would be triggered is if you go a period of time after 65 and you leave an employer plan and don't sign up for Medicare. You've got a certain window to do that. If you go beyond that, then you become a late entrant. Yes, it puts you in a rabbit hole you don't want to go down. There is no requirement. In spite of it, I almost have people want to argue with me and say, well, I don't think you're right, that you have to do something. I said, well, did Medicare or the federal government send you a letter saying you have to do something? In most cases, no. Well, but everybody tells me I have to. So again, it's probably one of the biggest myths of Medicare is I have to do something at 65 or else, and that's not correct.
Yeah, it typically comes down to just doing a cost analysis. What is Medicare going to cost me versus what is the group plan going to cost me? It's not really about benefits. We'll absolutely take a look at the benefits. Medicare is typically always going to beat a group plan, almost always. So it really just comes down to cost on a monthly basis. So let's say you're turning 65 and you're going to continue to work, and the group benefits here at work are amazing. They put a lot of money towards it, so you're just going to stay under the group plan. And then at 68, maybe 3 years later, you're gonna decide to retire. Totally fine. You're just in a special enrollment window. You still go out, and we're going to talk about this. You still go out and you enroll in A and B. You just have to go one step further. You're going to have to get what's called an L564 form completed, and you have HR fill that out. They give it back. You turn it in with your application, and that proves you've had credible coverage since you've turned 65. So no late enrollment penalties can be assessed. So that's the extra step with the special enrollment window. You can also qualify for a special enrollment period after you're already on Medicare. If you move across the country, if you have an Advantage plan, you're going to have to change that Advantage plan and go pick a new plan to, in the new part of the country you're at. So, so if you go beyond the age of 65, don't worry. You get the L564 filled out, and you're good to go. Okay, annual enrollment period. This is going on right now, October 15 through December 7th. This is why all the commercials and all the phone calls, if you're 65 or coming up on it, are happening. All right, so this is when everybody can change their plans. Very similar to at work. You guys have open enrollment. Here's the plans next year. Pick one out by Friday next week. All right, same difference. Everybody's got to make their changes if they want to by December 7th. Every year. So it's a short little window to do it. So that's why during this enrollment, you can go from one side of the chart to the other. So you can have a original Medicare and flip over to the Advantage plan, or you can have an Advantage plan and try and get back over to original Medicare. You can change your drug plan. If you have an Advantage plan, you can change to a different Advantage plan. So it's just a really, really busy time, and there's 60 million people all trying to do it. So it's just a really busy time, and it's going to be that way for a long time coming. Okay, so how do we actually enroll? It's all online through the Social Security Administration, so that's ssa.gov. You go out there, and the link to sign up for Medicare is right there smack dab in the middle of the screen. It truly says sign up or apply for Medicare. Now, if you don't have what's called a My Social Security account, we strongly advise everybody just go create one. I've got one, and it tells you what your earnings history is. It's just a great little resource to have. But you've got to have one in order to sign up for Medicare. So if you don't have one, go create it. It actually can be probably one of the biggest hurdles for some people if they have to prove their identity and they can't do it, and the next thing you know, you're waiting for a letter in the mail with an authorization code. So if you don't have a My Social Security account, go establish one.
It doesn't trigger Social Security or do anything. It's just there to check things, and you got to have it, like Grant said, to enroll. And as part of the application, it says, "Do you have a My Social Security account?" No. Well, then you end and stop. You can't proceed with enrolling until you have one.
That first bullet point there, you'll see you are automatically enrolled if you are taking Social Security benefits. So if you have a spouse that is taking Social Security benefits and they are coming up on 65, they will automatically be enrolled in Medicare. So they will get a card sent to them about 90 days before their birthday. So If that pertains to you, be on the lookout for that. If you don't want Part B, because it does cost a monthly premium, you have to let them know. Otherwise, they're just going to start charging Part B right out of your Social Security. We have met with a few people, not too many, but a few that we get their Medicare card and they say, yeah, I've got Part A, I've had it for about 10 years, and voila, Part B's on there. And they're like, oh my gosh, you're telling me I've been paying these Part B premiums the whole time, I've never even known. So be aware of that. And then, beyond the age of 65, let's say you're contributing to an HSA and you want to start, let's say you're at your full retirement, 66 in 4 months, whatever it may be, and you're contributing to an HSA, but you also start taking your Social Security benefits because you can take your benefit and make as much money as you want, right? Well, be ready, because as soon as you take that Social Security retirement, even if you're not looking to actually go on Medicare, they will enroll you in Part A only, and you won't be able to contribute to that HSA. So I know I just threw a lot out there, but that's something to consider too. So again, enrolling in Medicare, all online, www.ssa.gov. Once you get Medicare A and B, 2 to 3 weeks later, you've got your red, white, and blue Medicare card. It says your name, you've got your ID number with A and B, you're ready to go. You're ready to take the final step and go down the left side or the right side of the chart and get enrolled in a supplement, in a drug plan, or an Advantage plan. And that's our presentation today. So again, this is Sam. I'm Grant. If anybody has questions, feel free to ask away. If anybody wants to come ask the questions privately, we are happy to do that as well.
And guys, we offer our services at no cost. So if you want to meet either like via Zoom, our office is at 435 in Metcalf in Kansas City. I actually get up here periodically. I've done a lot of work down the street here with Bush Mize for many years and help people there on Medicare. But we can do Zoom meetings. But we can drill down and show you more specifically the left side and the right side and time frames and costs and all that, options that you might want to consider. So with that, thank you guys so much for your time this evening.